Well, today we are at the Fairfax Vascular Center, and ladies, if you have fibroids, if you know someone who has fibroids, friends, family, you want to listen up. We are with an expert, Dr. Jay Varma.
Hi.
So first of all, let's just start with the basics. What are fibroids? What are symptoms? Who's most at risk? Let's start there.
Well, first of all, thank you for having me. I appreciate the opportunity to speak with you. So uterine fibroids are benign tumors of the uterus that affect women generally in their 40s.
Okay.
Again, keyword being benign, that cause multitude of symptoms. Most commonly, they cause heavy bleeding, menorrhagia, heavy menstrual cycles. They also cause pelvic pressure and pelvic pain. So again, women in their 40s generally are affected by the fibroids, coming in with complaints of, Dr. Varma, I have very heavy menstrual cycles and I have pelvic pain and cramping. In general, about 40% of all women will have fibroids at one point in their life by the age of 40, 45.
Okay.
Of those, about half of them have symptoms. So most people don't have symptoms, in fact, or about half have symptoms, half do. 50% of African American women will have fibroids.
Wow, interesting. So for people that have, fibroids, then, the next question is, okay, we've diagnosed that you have it. Now we want to treat it and take care of it. And that's where you come in. And also as an interventional radiologist. So let's talk about some of the treatments and what specifically you guys do here.
I think the most important thing for women and patients to understand is that they have options. Option number one is to wait until menopause, which on average is about 51. Not a great option for somebody coming in who is really suffering. There are medical therapies which generally don't work very well. They can sort of temporize the symptoms. There are surgical options such as myomectomy, which is generally done laparoscopic by your gynecologist, where they laparoscopically remove the fibroids. The other option is hysterectomy, which is also a surgical option. As an interventional radiologist, we do a procedure called uterine artery embolization, also known as uterine fibroid embolization. It's a minimally invasive outpatient procedure where we make a tiny nick in the skin, insert a small catheter the size of a noodle. We find the blood vessels that supply the fibroids. We plug them up with little beads. It causes the fibroids to shrink and die. Whether you have one fibroid or 100 fibroids, it does not matter. The beads will target all of the fibroids, causing them all to shrink and die.
Which is exactly what you want. And again, I heard minimally invasive, and I think that that's what a lot of people are probably looking for. I'm going to guess that maybe means less, maybe a shorter recovery time.
I think one of the nice things about the procedure is that it's outpatient based, minimally invasive with a short recovery time. We do it in our office at the Vascular Center. Patients are sent home the same day. The recovery time is not necessarily from the invasiveness of the procedure or an incision. They leave with a Band-Aid. The recovery has to do with post-embolization symptoms. Some pain, some cramping, maybe some nausea, low-grade fever, feelings of malaise, generally kind of flu-like symptoms that last about 7 to 10 days. So we're going to make sure we take care of you with medications before, during, and after to make sure that you're comfortable.
Well, I think that you guys definitely offer some great options here at Fairfax Vascular Center. Dr. Jay Varma at the Fairfax Vascular Center.
Thank you very much. Thank you.
More Good Morning Washington next.